right, and we're rolling. Whoever wants to go first.
Hey, we're going. Well, we go.
All right, clap it up.
Side of the head.
Temporal.
Side of the head.
Temporal.
Front of the head.
Frontal.
Front of the head.
Frontal.
Top of the head.
Parietal.
Top of the head.
Parietal.
Back of the head.
Occipital.
Back of the head.
Occipital.
Mastoid.
Mastoid.
One more time.
Mastoid. Tragus. Tragus.
Side of the cheekbone.
Zygomatic arches.
One more time.
Zygomatic arches.
Top of the cheekbone.
Zygomatic.
Top of the cheekbone.
Zygomatic.
Top of your lip.
Axilla.
One more time.
Axilla.
Full part.
Mandible.
Mandible.
Mandible. All right, C1. Atlas. C1. Atlas. C2. Axis. Axis. 4. Cut the airway. 4. Cut the airway. 5. Penguin's knot. 5. Penguin's knot. 7. Hard to take a picture. 7. Hard to take a picture. What's the hole at the base of the skull? Foramen magnum. What's this? Foramen magnum.
Paralysis below the nipple line is what?
T5 injury.
What is it?
T5 injury.
Paralysis below the umbilicus is what?
T10 injury.
Is what?
T10 injury.
How many vertebrae in the lumbar?
5.
And it makes an S shape because it's a
Shock absorber.
Spinal cord ends at
L2, L3.
spinal cord ends at
L2, L3.
sacrum has
5.
and there
Use.
coccyx has
4.
and there
Use.
Alright, this bone's not funny to break. What's it called?
Humerus.
What's it called?
Humerus.
Don't tie it up. What's the top bone?
Radius.
What's the top bone?
Radius.
Bottom bone.
Ulna.
Bottom bone.
Ulna.
Rotate your wrist. What are those called?
Carpals.
What are they called?
Carpals.
Top of the hand. Top
Metacarpals.
of the hand.
Metacarpals.
Fingers.
Phalanges.
Fingers.
Phalanges.
Most frequently broken bone.
Clavicle.
Most frequently broken bone.
Clavicle.
Least frequently broken bone.
Scapula.
Least frequently broken bone.
Scapula.
What are your pants laying on?
Iliac crest.
What's it called?
Iliac crest.
Feel. What's the flat bone in your body?
Ilium.
What's it called?
Ilium.
Hand, cheek, squat. What do you sit on?
Ischium.
What do you sit on?
Ischium.
What's the largest bone in your body?
Femur.
What's it called?
Femur.
What are your kneecaps called?
Patella.
What's it called?
Patella.
What's the inside bone?
Tibia.
What's it called?
Tibia.
What's the outside?
Fibula.
What's it called?
Fibula.
the bones that right and rotate your ankles are yours.
Dorsal.
The bones that right and rotate your ankles are yours.
Dorsal.
Top of your feet are yours.
Metatarsal.
Top of your feet are yours.
Metatarsal.
Toes are yours.
Phalanges.
Toes are yours.
Phalanges.
Airway. Let's get airway.
On the nose and I.
Warm the air.
On the nose and I.
Warm the air.
On the nose and I.
Spin the air.
On the nose and I.
Spin the air.
On the nose and I.
Filter the air.
On the nose and I.
Filter the air.
On the nose and I.
Moisten the air.
On the nose and I.
Moisten the air.
On the back wall, what am I?
Pharynx.
And the back wall of the nose?
Nasal pharynx.
Mouth?
Oral pharynx.
And at the larynx?
Laryngopharynx.
And if it's broken up into four, it's the?
Hypopharynx.
I'm the leaf light protector of the airway. Who am I?
Epiglottis.
Who am I?
Epiglottis.
The shelf above me is called the?
Molecula.
Shelf above me is called the?
Molecula.
On the frontal tube that carries air, what am I?
Trachea.
What am I?
Trachea.
What's the first ring of the trachea?
Glottic.
What is it?
Glottic.
What's the second ring of the trachea?
Subglottic.
What is it?
Subglottic.
I am the point of bifurcation where the trachea branches into two. What am I called?
Carina.
Again?
Carina.
Also known as the?
Carina.
Again?
Carina.
At the bottom of the trachea, I split into two. What am I?
Bronchi.
What am I?
Bronchi.
And I split into smaller branches. What am I?
Bronchioles.
What am I?
Bronchioles.
I'm like the great black cluster where there's also gas diffusion. Who am I?
Alveoli.
Who am I?
Alveoli.
On a tree, the trunk is the?
Trachea.
Branches are the?
Bronchi.
Smaller branches are the?
Bronchioles.
The leaves are the?
Alveoli.
Wait, you mean the 499? What do I say?
The great light. No, you did that one. You did that one bomb. I am the great. That was bomb. Everybody ready?
Eddie, you better get down.
I am the dirty deoxygenated blood from your feet, your legs, and your groin, and I collect into
Inferior vena cava!
what?
Inferior vena cava!
I'm the dirty deoxygenated blood from your face and from your head, and I collect into the what?
Superior vena cava!
One more time.
Superior vena cava!
I take the dirty deoxygenated blood from the inferior vena cava and the superior vena cava, and I'm pumped through
Right atrium!
The more I stretch,
The more it contracts!
the more I stretch,
The more it contracts!
the more I stretch,
The more it contracts!
too much stretch.
Off goes the weasel!
I am the first door into the heart. All dirty deoxygenated blood must go through me. What am I?
Tricuspid valve!
What am I?
Tricuspid valve!
I am the muscle that pulls on the choroid tendon and opens the valve. Who am I?
Papillary muscle!
Who am I?
Papillary muscle!
Who am I?
Coronary tendonite!
Who am I?
Coronary tendonite!
The papillary muscle pulls on the choroid tendonite. It opens the valve. When it relaxes the valve like a door. I am located below the tricuspid valve. Who am I?
Right ventricle!
Who am I?
Right ventricle!
I'm the only artery in the body that carries deoxygenated blood. Who am I?
Pulmonary artery!
Who am I?
Pulmonary artery!
I'm the great black clusters of the lungs, but I'm also the wash machine for the heart. What am I?
Alveoli!
What am I?
Alveoli!
All the clean blood goes to me and then I send it to the heart. Who am I?
Pulmonary vein!
Who am I?
Pulmonary vein!
I am located right after the pulmonary vein. What am I?
Left atrium!
What am I?
Left atrium!
I am the bicuspid valve, also known as the
Mitral valve!
also known as the
Mitral valve!
I am the most largest, strongest chamber of the heart. And baby, when I thrust, I say, baby, when I thrust, who am I?
Left
Who
ventricle!
am I?
Left ventricle!
I'm the last door of the heart. All blood goes through me into the rest of the body. What am I?
Aortic valve!
What am I?
Aortic valve!
I'm the trap door that sends the fresh blood to the heart before it goes to the rest of the body. What am I?
Coronary sinus!
What am I?
Coronary sinus!
Clean oxygenated blood goes through me and into the rest of the body. What am I?
Aorta!
What am I?
Aorta!
I'm the tricuspid valve. I'm married to the
Bicuspid valve!
married to the what?
Bicuspid valve!
I'm the aortic valve and I'm married to the
Pulmonic valve!
What am I married to?
Pulmonic valve!
Okay, so welcome to the COPD family. I'm known as the blue bloater. Who am I?
Chronic bronchitis!
Who am I?
Chronic bronchitis!
I'm known as the pink pumpkin. Who am I?
Emphysema!
Who am I?
Emphysema!
You put children into the sniffing position.
At the shoulders!
Adults,
At the head!
I'm a mini stroke. I usually clear up within 24 hours. What am I?
TIA!
What am I?
TIA!
I am the SA node. I have a firing rate of what?
60 to 100!
I am the SA node. I have a firing rate of what?
60 to 100!
I am the AV node. I have a firing rate of what?
40 to 60!
And I'm the ventricles. I have a firing rate of what?
20 to 40!
It goes boom,
Kaboom!
boom,
Kaboom!
boom.
Kaboom!
the process in which air goes in and out of your lungs for gas diffusion. What is that called?
Respiration!
The mechanical process in which air goes in and out of your lungs. What is that called?
Ventilation!
Okay, for the rate, 6 rights for patient medication.
Right patient, right drug, right route, right dose, right time, right documentation.
Nice.
All right, class. There are 3 stages of shock. The first is called.
Compensated!
The first is called.
Compensated!
The second is called.
Decompensated!
The second is called.
Decompensated!
And the final stage is.
Irreversible!
The final stage is.
Irreversible!
And when you're in the final stage, you die. Now there are two major types of stroke. The first is caused by a bleed in the brain. What's it called?
Hemorrhagic.
What's it called?
Hemorrhagic.
And the second is caused by thrombus or an embolus that clots the cranial artery. What's it called?
Ischemic.
What's it called?
Ischemic.
Let's take you through the glands. The first gland is seated in the brain. What's it called?
Pituitary
What's
gland.
it called?
Pituitary
The
gland.
second is a portion of cells seated on the pancreas. It secretes insulin. What's it called?
Isthmus of Langerhans.
Let's hear that accent.
Isthmus of Langerhans.
Say it with your chest.
Isthmus of Langerhans.
Now there are the two final glands. They sit on top of the kidneys. What are they called?
Adrenal glands.
What are they called?
Adrenal glands.
What are they called?
Adrenal glands.
Ligaments. What do they do?
Link bone to bone.
What do they do?
Link bone to bone.
Tendons.
Tie muscle to bone.
What do they do?
Tie muscle to bone.
There are two ways to administer medication to a patient. The first can either be administered orally, and that's called
Enteral.
That's called
Enteral.
And the second is by absorption or injection. What's that called?
Parenteral.
What's it called?
Parenteral.
Okay, so babies have two fontanelles. If a fontanelle is bulging, what does that mean?
Pressure.
And if it's sunken?
Dehydration.
Okay, if I handed you a BBM right now, how much oxygen would it supply?
21%.
And if it was hooked up to oxygen?
100%.
And if I handed you that BBM, how many people would you need to operate it?
2.
What does the first person do?
Hold still.
The second person?
Ventilate.
What are the symptoms of BBM someone?
Shallow and inadequate breathing.
Okay, why did you put someone in a full Fowler's position?
Shortness of breath.
Semi-Fowler's?
Chest pain.
Right, left lateral recumbent?
Pregnancy of pregnancy.
Okay, and if you found someone prone, what do you do?
Flip them to the back.
Unless,
They
have something sticking out of their back.
okay, what's another term for shock?
Hypoperfusion.
What are the 4 reasons you put someone on a nasal cannula? The first one is?
Already on one.
What is it?
Already on one.
The second one is?
Actively vomiting.
What is it?
Actively vomiting.
The third one is?
Claustrophobia.
What is it?
Claustrophobia.
And the last one is?
Placebo effect.
What is it?
Placebo effect. Yeah.
All right, I'm the red blood cells and I carry oxygen throughout the body. Red blood cells are also known as?
Erythrocytes.
Also known as?
Erythrocytes.
I attract oxygen to the blood. What am I?
Hemoglobin.
What am I?
Hemoglobin.
I fight infection. What am I?
Leukocytes.
What am I?
Leukocytes.
I plug holes. What am I?
Platelets.
What am I?
Platelets.
I'm the river. What am I?
Plasma.
What am I?
Plasma.
All right, for suctioning, how long do you suction a go for?
No more than 15 seconds.
For a child.
No more than 10 seconds.
For an infant.
No more than 5 seconds.
And the nervous system is divided into 2 parts. What are they?
Central and peripheral.
What's included in the central part?
Brain and spinal cord.
And peripheral lets you feel what?
Environment.
What's the most common cause of bradycardia in children?
Respiratory.
What's the most common cause of bradycardia in children?
Respiratory.
There are 4 signs a child is in respiratory distress. The first is?
Nasal flaring.
What is it?
Nasal flaring.
The second is grunting.
Grunting. Whoa.
The third is?
Seesaw breathing.
And the fourth is?
Head bobbing.
Central pulse points are your,
Carotid. Femoral.
your,
Esophageal.
and your
Dorsalis penis.
peripheral pulse points are your,
Radial. Radial.
and your.
Capillary.
Not all wheezing is asthma. A fireman coming out of a smoky building is.
Smoke inhalation.
Child 1 and under is.
Bronchiolitis.
A heart attack is.
Cardiac asthma.
An allergic reaction is.
Anaphylaxis. Skin.
What do you do?
Sex prognosis.
Player.
Subcutaneous fat.
Now when I say fight or flight, what do you say?
Sympathetic nervous system.
What's it called?
Sympathetic nervous system.
Now when I say breathe, what do you say?
Sympathetic nervous system.
What's it called?
12 to 20.
Average respiratory rate for a child is
20 to 30.
average respiratory rate for an infant is
30 to 40.
average respiratory rate for a neonate is
40 to 50.
average respiratory rate for a newborn neonate is
50 to 60.
what is a neonate?
First 30 days.
What is a neonate?
First 30 days.
What is a newborn neonate?
First hour.
What is a newborn neonate?
First hour.
How many muscles in the body?
Over 600.
The protective layering around the lungs is the
Visceral.
what is it?
Visceral.
And then around the thoracic cavity is the
Right.
all right.
Adam's apple is also known as
Thyroid cartilage.
the what?
Thyroid cartilage.
And under that is
Cricoid cartilage.
the what?
Cricoid cartilage.
And in between the two is
Cricoid thyroid membrane.
the what?
Cricoid thyroid membrane.
What's the narrowest portion of a child's airway?
Cricoid.
Because it's
Hourglass.
Alright, there's two danger zones. Alright, upper left,
Spleen.
upper left,
Spleen.
lower right,
Appendix.
lower right.
Appendix.
when you're adding to the body it's called
Abduction.
when you're taking away from the body it's called
Abduction.
Heart rate times stroke volume equals,
Cardiac output.
also known as,
Perfusion.
again,
Perfusion.
a seizure lasting greater than 5 minutes or multiple seizures in a row without a level of responsiveness in between is called,
Status epilepticus.
again,
Status epilepticus.
an asthma attack that can't be broken with medication is called,
Status asthmaticus.
again,
Status asthmaticus.
My friends, there are two types of circulatory systems. Systemic is,
Head to toe.
pulmonic is.
Lungs.
What is arteriosclerosis?
Hardening of arteries.
What is a fat globule in an artery?
Atherosclerosis.
So we all know that the hair, the skin, and the skull protects the brain. But there's also 3 layers called the what?
Meninges.
The first layer is called,
Neural matter.
what is it?
Neural matter.
That's right, I'm the tough mother. And then the second layer is called,
Arachnoid.
what is it?
Arachnoid.
That's right, I'm Spider-Man, baby.
And then the third layer is,
Pia.
what is it?
Pia.
I'm the little Pia.
So bleeding between the skull and the dura is
Epidural bleed.
most commonly found in,
Children.
and what does it present with?
Sudden unconsciousness.
And then bleeding between the dura and the arachnoid is
Subdural bleed.
most commonly found in,
Adults.
and it presents with,
Intoxication.
and then swelling of all the meninges is,
Meningitis.
bruising around the umbilicus is what?
Coincide.
What?
Coincide.
Bruising on the sides is what?
Ray Turner sign.
What?
Ray Turner sign.
What are the 3 muscle types?
Cardiac smooth skeletal.
What are they?
Cardiac smooth skeletal.
Syncope is what?
Fainting.
Near syncope is what?